So now let's look at the plan that most people are buying that are born after January 1st, 55, starting Medicare after January 1, 2020, and that would be the G plan. So if I choose to go with a supplemental plan, what is happening is I'm staying in what we call the original Medicare system. Okay, so what we have to do to understand this system is to realize that Medicare pays and pays pretty well, but it does not pay for anything 100% other than preventive services. So every healthcare cost that we get in original Medicare, I'm going to have some cost sharing. I'm going to have some liability, some financial responsibility. We call those gaps in coverage, hence a Medigap policy. And there's actually 6 gaps in original Medicare. Now, when we're enrolled in Medicare Part A, there's no premium for that, as I mentioned. And so if I'm using Part A, that means I've been admitted to the hospital, I'm going to have a deductible that is due for that hospitalization. And that deductible is my full out-of-pocket for up to a 60-day stay. Now, let's say I'm in the hospital and I'm discharged, and then 3 or 4 months later I go back in the hospital, I actually can pay that deductible again. That is not an annual deductible, it's tied to a benefit period. And a benefit period begins when I'm hospitalized, and then I'm discharged. 60 days later, then a new benefit period would begin if I am re-hospitalized. So it's not annual, it could be paid multiple times. That's the first gap I have in original Medicare. Now, that deductible covers everything out of my pocket for the first 60 days in the hospital, which is a long time, going to cover probably 99% of every situation. But if someone happens to be in the hospital longer than 60 days, this means continuous days. What happens is from days 61 to 90, now I have a daily copay of $389. You do the math on that, that's month 3, and it's going to cost you $12,000. Month 4 and month 5, they double the copay. So this would be days 91 to 150. Okay, now I'm paying about $800 a day. You do the math on that, that's about $25,000 a month. These are called extended stays in the hospital, and they're very, very expensive. So that's our second gap. And our third gap in original Medicare would be skilled nursing. This is for someone that's had a stroke, maybe a hip replacement, injury, fall, accident, something like that, where they have to have skilled nursing inpatient type rehab. So the rules are, Medicare says the first 20 days from 0 to 20, Medicare doesn't charge anything at all for your skilled nursing expenses as long as we had a 3-day stay in the hospital. They cover everything the first 20 days. After that, I have 80 more days of coverage, days 21 to 100, but now I'm going to be responsible for a daily copay. They tell me right now the average stay in skilled nursing for Medicare recipients is about 30 to 35 days. So the average person is spending about $2,000 to $3,000 out of their pocket for a skilled nursing stay. And here's my point. These are the gaps in Medicare. So my deductible for the first 60 days is my first gap. It could be paid multiple times a year. And if I ever have a long extended stay in the hospital, that creates my second gap. And now I have copays for all those days for month 3, 4, and month 5. 3 gaps on the A. Let's go to the B of Medicare. Now, B has a premium. We've already discussed that. If you're on Social Security, that B premium comes right out of your check. I have to be enrolled in A and B, whether I have a supplemental plan or an Advantage plan. And so the gaps on the B side would be these. We have a deductible on the B of Medicare. Now remember the distinction. This is everything inpatient, this is everything outpatient, as well as doctor-related services. So if I see a doctor in their office or the doctor comes to treat me in the hospital, it is still the B of Medicare that's going to pay those doctors. All right, so we start the year off with a deductible. It's very low. It's just an annual deductible, a calendar year deductible, $233, very small. And then after I've met that deductible, my second gap then is 20% coinsurance. So here's what happens. On anything Medicare covers, Medicare pays 80% and you pay 20%. We call your part coinsurance. Now the problem with your part, your 20%, it never, ever, ever stops. If we get insurance, a Medigap policy, we can stop the 20%. But if we don't have a Medigap policy, you pay that 20%. Actually, this is the biggest risk on Medicare because this is where all the doctors are paid. So if you have some kind of a serious illness, maybe a surgery, every doctor that you see in their office or they treat you in the hospital, a surgeon, anesthesiologist, you would pay them that 20% and it never ever stops. And then the last gap on the B side of Medicare is called an excess charge. Now, excess charges are limited only to physicians. Hospitals do not charge these. Durable medical equipment providers do not charge these, only doctors. And this is a doctor that will see you as a Medicare patient, but will not agree under a contract to take Medicare approved reimbursement amounts. amounts. That's called an assignment amount. And so a doctor that doesn't take assignment can legally add to the bill 15%, and when they do so, you're responsible to pay for it. Now, not all doctors do this. Some do, especially some of your specialty places, Mayo Clinic, MD Anderson, Cleveland Clinic, those kind of places will add the 15%. But what I'm trying to teach you is these are the gaps on the B of Medicare, and there's three again. We have the deductible, and then we have 20% coinsurance and 15% excess charge. So these gaps are your responsibility. So we got three gaps on the A and three gaps on the B. And so the majority of people that choose to stay in original Medicare don't want the responsibility of all these gaps, so they'll take the gaps either fully or almost in full and transfer those to an insurance company. And they'll pay that insurance company a premium. And folks, this is really what we do with all insurance. If I wreck my car, I do not want to pay for the repairs, especially if I'm the cause of the accident. Everyone else's cars have to be repaired. So what do? I pay a premium to an insurance company and I transfer the liability of that wreck and those damages to them. I pay them a premium and they take care of those expenses. Same thing for homeowners. My home burns down. I don't want to rebuild it. So I have a homeowner's policy. I've transferred the risk of that to my homeowner's insurance company. And if my home burns down, they're going to rebuild it. Same thing's happening here. These are your risks in healthcare today in original Medicare, and you can transfer all the risk or most of the risk away. All right, so that's the gap. So when we do a supplemental plan, this is what we're doing. We're getting these gaps covered. Hey, just real quick before we get to the next part of the video, I just want to remind you to like, subscribe, or put a comment there in the section below and ask any questions that you would like us to address. And then just one more thing, you'll find down below in the description, there's some links there where you actually can schedule an appointment to talk to one of our Medicare guides. So if you need further advice, look at all your options, we'd be happy to help with that as well. Now, I would say about 95 to 97% of all people are going to buy one of three supplemental plans. There's actually 10 of them that are available. They're all given a letter A, B, C, D, F, G, K, L, M, and N. I'm going to just talk about the top three plans that most people are buying today. The top plan would be, top meaning the most coverage plan, would be the F plan. Now, the F plan is truly a full coverage plan, 100% medical coverage, which means the gaps that I just taught you are going to be covered by that F plan. It'll pay the deductible, regardless of how many times it occurs in the year, extended hospital copays. It'll pay all your skilled nursing copays. It covers the B deductible, the full 20% in excess if and when that ever occurs. It truly is a full coverage plan. And I have thousands and thousands of clients on F plans, and I've told them all, when you have an F plan, if you get a bill, don't pay it, because you really should never get a bill. As long as Medicare pays first, that F plan will follow and will fill in all the gaps. Sometimes people get a bill on an F plan because it was miscoded. That can be corrected and refiled, or maybe they did something Medicare didn't cover. Because if Medicare doesn't cover, neither will the F plan. But if Medicare covers, the F plan will fill in every single gap. All right, now what I'm going to do real quickly is I'm going to teach you the features of supplemental plans, because some of you are considering getting off of them, some of you are considering getting on them. So we're going to have to understand exactly how they're going to work. So regardless of the F plan, the G plan, or N plan, these features are going to be the same. Number one, if you get a supplemental plan, you never have to worry about a network. HMOs or PPOs are non-existent in original Medicare. As long as that provider that you want to go to, the hospital, the doctor, durable medical equipment provider, takes Medicare, they will absolutely take any supplemental plan that you choose. You have the right to choose whatever supplemental plan you want, whatever letter you want that's available in your state. And so they will absolutely take that supplemental plan. In fact, you don't even have to ask them if they do. You just ask, do you take Medicare? And if so, then they will take your supplemental plan. That's what we mean by no networks. Number two, there will be no referrals required. So if you want to go see your cardiologist or your orthopedic doctor or a dermatologist, or a lady who wants to go see her OBGYN doc, you simply pick up the phone and make the call, ask them if they take Medicare, and set up that appointment. There's no referrals required to see a specialist. Number three, there's also no pre-authorizations on supplemental plans. All right, what does that mean? Well, this is some type of an expensive service. It could be an MRI, it could be a CAT scan, it could be a skilled nursing stay, it could be an outpatient surgery or an inpatient surgery, but anything that's going to be on the more expensive side, what happens is this: Medicare says if they cover it and your doctor says you need it, you do not have to talk to your supplemental company at all for pre-approval. That's a pre-authorization, and they're non-existent with supplemental plans. In fact, most supplemental companies, when they give you your card, they'll put right on the front, no pre-authorizations. Why? Because that supplemental company, that insurance company, has no say-so whatsoever into your health care. If Medicare pays, they have to pay based upon the letter that you bought, okay? They're going to follow. If Medicare doesn't pay, they're not going to pay, but as long as Medicare pays, they will pay. So if your doctor says you need it and Medicare says we'll cover it, end of story, it's on the schedule, no pre-authorizations required. And then lastly here, lifetime policies. This is a nice feature of Medicare supplemental plans, especially for people that have health problems or they get health problems while on the plans, because they never have to worry about losing those policies. As long as you pay your premium, that's all you have to do. It doesn't matter how many claims you have. It doesn't matter how old you may become. It doesn't matter if you move from one state to another state. You take those policies with you. You pay the premium. It truly is a lifetime plan. All right, so if we go with an F plan, G plan, or N plan, you'll see all these features exist within those plans. Now, I do want to mention one very key factor about F plans, and that's this. Many of you watching this may not be able to buy them because we're in this process now of phasing out the F plans. Been in the process now for about 5 years. And here's the rules for getting F plans. Anyone that is born before January 1st, 1955, which means they started their Medicare or were eligible for their Medicare before January 1, 2020. That's a group of people were grandfathered in. You can still buy F plans and you can keep those F plans your whole life. But if you're born after January 1st, 55, starting Medicare after January 1, 2020, you can no longer buy an F plan. And that's what takes us then to the G plan. So now let's look at the plan that most people are buying that are born after January 1st, 55, starting Medicare after January 1, 2020, and that would be the G plan. Okay? And so remember, we have 6 gaps in Medicare. We get a Medigap policy to fill in those gaps. The G plan and the F plan only have one difference as it relates to coverage, and that's this. If you have a G plan, it covers all the gaps except for the B deductible. So that G plan will pay A deductible no matter how many times it happens, extended hospital copays, extended skilled nursing copays. It will not pay the B deductible. It covers the full coinsurance and all excess charges if and when they occur. So that is the one item that will be different. So if I'm on a G plan, what's going to happen is once a year, and that's it. I'll have to pay the first, in this year, the first $233. That's called the B deductible. Sometimes as we move forward year to year, this resets every January. Sometimes it stays the same, sometimes it goes up a little bit. But whatever the B deductible is, if you have that G plan, then you'll be responsible for that first $233 or whatever the B deductible is out of your pocket. So we're going to get a total of $233 in bills. Medicare pays, G pays everything but the first $233. The F plan paid everything, including that. G does not. Now, just as a side note here, if you even could get an F plan because of your age, most people are not today because there will be enough premium difference between the F and the G to more than offset the B deductible. So in fact, I can't even tell the last time I sold an F plan. It's been years ago now because there's a premium difference between F and G, and that savings, say $40, $50, $60 a month, is more than enough to offset that B deductible, plus more people are going on Gs, so you'll be in a bigger group, therefore a greater amount of rate stability. All right, and so that is the G plan. And as I said, all those same features, no networks, no referrals, no pre-authorizations, lifetime policies on the G as well. Okay, there's one other plan I'm going to explain to you that some people are going with today, and that is called the N plan. All right, so here are the details for that N plan. Okay, first off, again, it's a different letter, so we have a different amount of liability than the G and the F. And so what's happening with the N plan is this. It will cover the full A deductible. It'll cover all skilled nursing copays as well as extended hospital copays. So identical with the F and the G over on the A side of Medicare. But here's where it's going to be different. If I have an N plan, I am going to be responsible for the B deductible. Remember, that resets every January. Just like the G plan, you'd pay that out of your pocket. But here's where it's going to get different. Okay, so the N plan will pay the 20% coinsurance fully, but it will not pay excess, so we have 2 gaps on the B that are not covered by the N plan. And notice, every time you see a doctor, you're subject to a $20 copay. If you go to the emergency room, you're subject to a $50 copay. Again, very reasonable, and some people will go with the N plan because there's going to be a lower premium. Some places, some states, there's not a big difference. Others, there is one. But again, if you take the N plan, you're going to have a lower premium, therefore you're taking on a little bit more liability, and you just have to simply be comfortable with taking on that excess charge and some minimal copays if you take the in plan. And again, same features, no networks, no referrals, no pre-authorizations, and certainly a lifetime policy as well. So that's if we go with the supplemental plan. We stay in A and B, and we're going to get a supplemental plan to fill in the gaps.